As far as red signs or warning signs go, a child should be able to have social smile by the time they are 5 months or 6 months. The baby should be able to identify the mother, the father, and people who frequently visit their house, and should be able to respond to them with a smile. If that is not there, something wrong already. Like the child is not able to make that connect, the child is not able to recognize people, or the child sees them as someone who just comes and gives their basic needs and moves away. They are not able to emotionally bond. So these are signs that you would see for a child who might develop autism down the lane. Lack of social smile, not wanting to be picked up much, not crying so much, because usually babies by that time would love attention, want to be cuddled all the time, want you to take them in their hands every way possible. If you put them down, they will cry. But then babies who might develop autism or have high risk for autism will not show these signs. So that's one of the red flag signs that you can look out for. Another red flag sign for autistic kids who develop autism is history of regressing behaviors. So till around 1.5 years of age, they developed quite well. All their milestones are achieved. They might even interact with you, play with other kids, and start telling words. They might even pick up a good vocabulary. But around the time of 1.5 to 2 years, all of this starts regressing. By regressing, I mean it stops and starts reducing, where the child again becomes non-verbal, where they don't utter words or they are not able to relate with other kids. They would rather play by themselves alone than mingle with another group of children of the same age. This is another red flag sign that you can look out for. They want to be stimulated all the time. They want to play with water all the time, doing same repetitive hand movements, leg movements, and obsession with things that go round, like a fan or wheels. These are things that you would see in a child with sensory issues. And also problems with textures and the material of clothing that you can see. They will want to eat some type of food, but then they will not want to touch any other type of food. So these are sensory issues, and they hamper cognitive abilities of the child. Not necessary that every child who has sensory issues will develop autism. It's a main precursor or a main point that we kind of look into. So these are things when it comes to autism as such that you can look into as red flag signs. So problems with communication, repetitiveness, wanting the same thing again and again of a rhyme or a song. All of these are issues that you work with autism as such.
సంప్రదించండి చైల్డ్ డెవలప్మెంట్ సెంటర్, లిటిల్ స్టార్స్ అండ్ షీ హాస్పిటల్, బంజారా హిల్స్ రోడ్ నెంబర్ 10, హైదరాబాద్. ఫోన్ నెంబర్ 9154291745.